Video discussion on teamwork and leadership. Thank you for taking the time to see this in-depth critique of my management and teamwork philosophy. I am Rajni Raj and I want to discuss what I have learned about working across disciplines in a collaborative settings. Failure to collaborate can lead to inefficient management of resources and staff. The review of tactics proven to boost the productivity of multicultural teams led researchers to conclude that teams produce better results when they coordinate their efforts across specialties. Personal experience. When healthcare professionals form effective teams, they can achieve their goals better. Collaboration between different fields of study has enhanced patient treatment. Tanwar et al. 2020. I had many issues at my previous nursing station since I periodically had to deal with patient health records. Electronic health records (EHR) were developed as a replacement for paper medical records. Although implementing EHR was essential to bettering patient care, there were concerns that it should have been managed more cautiously. Due to insufficient implementation, patient safety was jeopardized. Despite the lack of proper procedures to protect patients' medical records, the hospital grasped the importance of the situation and quickly created a team consisting of nurse managers, doctors, IT specialists, and others to solve it. The implementation proceeded easily, but the hospital quickly discovered security issues that compromised patient information. After an incident involving a high-ranking government official, the hospital is being looked into for possible violations of HIPAA's data security regulation. Businesses in the healthcare sector are subject to strict regulations designed to prevent the improper use or disclosure of patients' protected health information (PHI). PHI is kept private thanks to HIPAA security clause and privacy regulation. Pokert et al. 2021. The hospital administration immediately called a special meeting to discuss the situation. Someone on the team manipulated the data and then leaked it for personal advantage. Thus, HIPAA initiated legal action against the hospital. As the team's head nurse, it was up to me to figure out what needed to be done and write a report. I called a meeting of our interdisciplinary group to discuss this and other possible EHR security flaws. Medical professionals were found to have been reckless with patient data according to the study. After learning that sensitive information had been left unattended in an unprotected area, that medical records had been shared with co-workers and acquaintances, and that the computer system had not been adequately secured, I developed plans to improve collaboration and prevent future security breaches. The administration should hold official and informal meetings with staff members to elicit improvement ideas. It is important to install a safety system as a safeguard against authorization problems. Most firms rely on access control. Van Nippenberg 2020. Individuals on the team comfort level with one another is crucial for open communication. Team members must share a common framework to investigate, analyze, and agree on patients' condition. The impact of poor collaboration on management of human and financial resources. Patients benefit from doctors and nurses collaborating with one another regardless of their fields of specialization. Multidisciplinary teams must collaborate when providing patient care. Novoa et al. 2021. Foreign intelligence can be used to achieve goals and gather insights and influence the workforce. Collaboration between specialists has benefits for patients, co-workers, and organizations. Medical teams are most effective when they make the most of their members' competence and information. On the other hand, there is proof that interdisciplinary teams might actually lower the standard of care providers deliver to their patients. The effectiveness of our healthcare system has an immediate impact on the quality of care that each person receives. A lack of good communication, teamwork in the workplace has been connected to dissatisfaction, medical accidents, a lack of resources, inadequacy, and decreased protection. It raises the odds that resources may need to be found or utilized. Professionals who have trouble getting along with one another could be afraid to admit wrongdoing for fear of punishment. The ease with how staff are able to discuss and address problems with authorities is a major factor in that success. Disputes among doctors have been attributed to delays and complications in patient treatment. We have the capacity to improve the level of cooperation between different fields via our skills. One of the major causes of death in the United States is the use of incorrect or outdated information by medical professionals. Poor project management is the result of poor teamwork. Workers can do more in less time when they pool their resources, ideas, and efforts. Implementation costs can be reduced by making the most of what is already in place. Nunes et al. 2022. However, the price of making up for late services escalates when the team dynamic deteriorates. Due to lack of coordination and increased error rates, healthcare administrators save money correcting mistakes. Employees who fail to collaborate together run the risk of having their roles confused, getting into arguments, and undermining the company's reputation because nobody is taking responsibility for anything. Grant 2021. Healthcare providers, enterprises, and other entities can all benefit from quick implementation of cooperation, authoritative leadership, and open communication. Enhancing an interdisciplinary team's effectiveness through the steering of its leaders. The leadership of an organization has a significant impact on its culture and the working conditions of its employees. Leaders who can transform their followers' perspectives are called transformational leaders. Leaders stand out when they can inspire their followers by showing them the way, providing context, and rallying the troops. They allow employees a voice in business decisions and inspire maximum effort from everyone. Successful healthcare reform implementation requires emotional intelligence and transformative leadership. Poor et al. 2019. They know that they can only succeed by cooperating. The business benefits from having an intelligent and innovative leader since it raises morale and increases output. Leaders who can unite their teams and spark innovative are crucial for every company facing current and future challenges. To increase morale and trust in the company, transformational leaders foster networks of mutual support among employees. The crew is motivated by their dedication to walking the talk as part of multidisciplinary unit. Everyone on the team will know they made a difference and take pride in the accomplishment. One of the benefits of transformational leadership is that everyone shares in the rewards and punishments of the group's actions. Lee et al. 2023. They keep the interdisciplinary team in constant contact to monitor progress, identify issues, and make the most of available resources. Most effective leadership techniques revolve around working together to complete a common mission. Strategies for collaboration between disciplines that improve team performance and results. The greatest possible outcome can be obtained only through cooperation among patients and many healthcare professionals. The entire staff works together, sharing knowledge and insight. Free and open communication is essential for any group to reach its goal and cooperate effectively. Open and honest communication between team members on how things are going and how they may better coordinate their efforts to increase the team's performance is crucial to the success of any team. Smythe et al. 2021. Setting feasible and mutually useful goals in the cornerstone of any productive interprofessional collaboration. This keeps everyone on the same page, prevents unnecessary competition for scarce resources. We have developed a stable channel of interaction amongst ourselves. The information required to enhance medical care can be gathered through open contact with patients and their loved ones. As a result of their combined efforts, employees grow to like and appreciate one another. Motivated individuals cooperate to accomplish the group's goals. People flourish as leaders when given the authority to lead in their areas of expertise. Members of a team are better equipped to collaborate when they can freely exchange information with one another. When medical professionals from different professions collaborate, patient care improves. Whether or not a kid is eligible for special education is a group decision made within the school context. Francisco et al. 2020. Working together, the team will eventually be recognized for their efforts. Conclusion. As a nurse who has worked in environments where interdisciplinary collaboration has been tested, I have seen firsthand the effects of inadequate treatment and coordination. In order to effectively manage both human and financial resources, interdisciplinary teams must have necessary skills and cohesion, as stated by Holman et al. 2020. Interdisciplinary groups are required to address global health issues. As a result, I am more certain than ever that a diverse set of viewpoints and capable management are essential for healthcare success. Thank you.